You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome back to SureCast, and now here's part 2 of our broadcast.
Avi, great to see you here at the SureCast Insights 2025. How you doing?
I'm great. How are you? So happy to be here.
Doing really good. And BluePax was a diamond sponsor, so we just wanted to thank you for helping to make this the first of their conferences that it's happening. I think it's going really well, and you kind of told me a story that when you found out about it, you guys were like, that's it, we're in. What was it about the partnership with SureCast that drew you to this conference?
Yeah, so since we've been established 14 years ago, we've been collaborating with SureCast because we were founded with kind of a sole focus at the time of servicing long-term care pharmacies, and SureCast was just a natural partner for that, just because of how much they were serving the market and how they were bringing value to the procurement side for long-term care pharmacies. So we've been partnered with them all these years, and they've always been so great to work with, and really just helping us, even as a young company, slowly become more established. And now that we've grown quite a bit from where we started, when they came to us and said, hey, we're running our first ever user conference, we just said, where do we sign? We're ready to go.
That's awesome.
Yeah.
All right, so Paul Shelton introduced me to you. Really excited to have an opportunity to talk with you because you have a special interest in the vaccine side of healthcare. And Paul and I constantly talk about long-term care pharmacy at home. So talk to me about the blending of all of those pieces of the puzzle and how BluePax is helping our pharmacies get into the home when it comes to vaccines.
Yeah, so we actually were one of the first auxiliary distributors that partnered up with Moderna when they came out with their COVID vaccines. So we've been working with them really from the first year that they went out to the market, and we slowly grew that now to Pfizer as well. And as an authorized distributor, we can work with any pharmacy in the country, helping them service their, GPO direct pricing. But I specifically linked up with Paul, I think it was around 6-7 months ago, when I finally learned about long-term care at home network and the amazing work they were doing. And I never even really understood that the market that they're addressing, long-term care at home, is so much wider and vaster than the traditional nursing home settings.
Yep.
And so as we were talking and as I was presenting him with some of our value proposition around seasonal vaccines, there just seemed to be this natural link, because we're trying to be super flexible and help pharmacies with their specific operational needs, whatever they may be. And so as we were slowly learning about the need for these pharmacies to also have immunization programs at home and the flexibility they needed around that, it just seemed like a great fit, because that's how we like to operate and really customize our approach to each different pharmacy partner.
What do you see as a challenge for long-term care pharmacy or even community pharmacy getting deeper into long-term care at home? What stories have you heard that you see challenges to do it?
I think the biggest challenge right now is probably education. From what I'm seeing, there's not enough kind of awareness at the community pharmacy level that there's actually so much more of a market that they can address besides their walk-in market, if you will. So I think long-term care at home is working, I think, right now with close to 1,000 pharmacies, but there's tens of thousands of more out there that could be servicing this growing population, right? This aging population, that not all of them, again, are going into institutional long-term care settings. And so I think a lot of pharmacies are just not aware of their ability to branch out beyond their walls and service their local community in a way that also makes sense for them as a pharmacy and for their own growth. So I think Long-Term Care at Home Network is doing a great job in terms of promoting that initiative. I think, though, it's very early on in its sort of initiative and needs a lot more to catch on in order to get more pharmacies involved. And I think being a combo pharmacy, kind of dabbling more in long-term care, can really help these independent pharmacies' viability and their sustainability, because a lot of them are struggling economically. So,
share with our listeners who didn't get a chance to come to the SureCast event the portfolio of BluePax Pharma.
Yes. So, beyond the vaccines that we're excited to work within that space, we do have over 5,000 SKUs. All dosage forms and therapeutic categories, including C3s through 5s. So that's like a relatively new program for us. We do operate in every state. We're DEA licensed, obviously, NABP accredited. And again, I like to call us an auxiliary distributor because we really thrive on partnerships with the pharmacy. We're not trying to pitch like the flavor of the moment or some kind of a special deal every time. Like, we really try to better understand every pharmacy's needs, both operationally and NDC-wise, and meet them where they're at. So we're kind of taking that approach to how we're doing our business, and I think it's worked pretty well so far.
Have you had any hot chicken or bourbon since you've been here in Nashville?
No, I haven't. I only got here yesterday, so I haven't had a chance to go out yet because I've been so busy. And I think that's been one of the great things about this show. We've met so many of our active customers. We've met so many that we don't currently work with. So we've been super busy. So that's been actually nice, but I do hope tonight to go and find a proper chicken sandwich somewhere.
Absolutely. Avi, this is so good to talk to you and meet you. Shout out to Paul Shelton for putting us together, and thanks for being on the show.
Absolutely. Thank you.
Hi, this is Brittany Young, Sales Director at Independent Pharmacy Distributor, and you're listening to the Pharmacy Podcast.
Brittany, we are here in Nashville at the SureCast Insight 2025 event. It's so good to see you.
Good to see you.
As I said, as I walked past your booth, I can't remember where I meet people, and I think it was, where was it? Was it NCPA?
So it might have been Independent Pharmacy Distributor, NCPA, but not me specifically.
Okay. Yeah, and I was like, there's so many conferences, so I think this is my 14th conference in 2025. And I keep promising my wife I'll do maximum of 8. So
We're a little past that number.
Yeah. A little fib. All right, tell me about Independent Pharmacy Distributor and why you guys took the time to come to Nashville to be here at SureCast.
Absolutely. So Independent Pharmacy Distributor, most of us, everyone knows us as IPD. We are a independent owned secondary wholesaler. We carry a full line of control C2 through C5, OTCs, DME, generics. We're moving into the brand space as well. I think what makes IPD different than a lot of the other wholesalers is that we are independently owned. We have several pharmacies in North Carolina as well. And we have built IPD from the ground up. When I started there 9 years ago, we had 300 drugs, and now we have more than 6,000 SKUs, so it's awesome. And we have found a way to work with independents in a special way. And SureCast was actually the first ordering platform that we have ever worked with, and they are the only ordering platform that IPD works with. So it's crazy that we're here. This is our first show. We're excited. We've met a lot of awesome people, but yeah, I think that is what makes IPD a little different than the other secondaries out there.
So tell me about the sectors of pharmacy. So obviously independent community pharmacy, that's like the bread and butter. That's probably like the core. Are you getting into long-term care? Are you getting into compounding? Like, talk to us about the other sectors.
For sure. So we do service several long-term care facilities. We also deal with compounding pharmacies, not bulk compounding, but we do a lot of injectables, testosterone being a huge one that we service compounding pharmacies with. Long-term care is definitely a sweet spot for us because we do carry that full line of controls, and those are obviously needed for those long-term care facilities. So yes, absolutely, that is something that we have grown into over the last 2 years especially.
And as a secondary wholesaler, do you have clients in all 50 states, or are you segmented to a specific sector?
So we service all 50 states. We are licensed in all 50 states, yes.
So what's your opinion of the state of independent community pharmacy? What do you think has to be done in order for us to really see the slowing down of pharmacy deserts? So we have to see pharmacies thriving to keep healthcare services in communities that desperately need their pharmacies. Some of their communities are losing pharmacies left and right. So what do you think has to happen for us to thrive in different communities that are suffering?
I think, honestly, independent pharmacies have to come together for one. I think that margins are extremely tight, and we have to find a way to fight against that. I think that reimbursements are non-existent for a lot of things, and I think that is a big part of the reason why IPD does so well with some of our independent pharmacies, long-term care, whatever it may be, is because if we can do the price and it's not below our cost, we're going to do it all day. And so I really do think that is everything right now. Every penny matters, and that's what's really important to most of the pharmacies out here.
Are you feeding data to pharmacy management systems and then tagging the same data into the SureCast system? But how are you working with those three components? We have the secondary wholesaler, that's you. We have the pharmacy. We have SureCast. We have the pharmacy management system. How are you guys tying into that?
So honestly speaking, we push our entire catalog into our EDI system, SureCast being the only, platform that we work with outside of direct EDI. But SureCast kind of does that work for us, I would say.
Yeah.
They do it, for us, for the pharmacies.
Very good. That's why I was asking the question, because SureCast does that for other secondaries as well, skipping having to do it manually by the, pharmacy owner or whatever that they're doing.
Absolutely.
So where do you see the future of pharmacy going? Do you see more hands-on treatment management? Do you see them making more cash money on things that aren't necessarily tied to a PBM? Do you see any opportunities for independent community pharmacy?
I think both of the things that you just mentioned are very smart and good opportunities that I think a lot of independent pharmacies are already moving towards. Absolutely. Especially when it comes to cash, patients that are staying away from the PBMs on specific medications, obviously. It's the only way to stay afloat for a lot of pharmacies, especially smaller volume stores right now.
Yep. All right. What's your next conference that you'll be at in 2026?
So we have a lot coming up. We are actually doing a lot of smaller state show conferences. We've never done that before, so we're excited. So we will be in Colorado at the Colorado Pharmacists Association in Beaver Creek.
Okay.
We'll be there. We're doing Pennsylvania Pharmacists Association in Pennsylvania. We're also going to be at the Pharmacy Profit Summit in Dallas. We'll be there. So we have a lot coming up.
Yeah, we'll be at the Profit Summit as well.
Awesome.
Lisa Fast does an amazing job, and we love getting together with people who are creative that want to build new ways of running business.
This will be our first year there, so we're excited to go.
Oh, you're going to love it.
Yes, we're excited.
All right, Brittany, thanks you so much for being on the show.
Thank you. I appreciate it.
Hey guys, this is Bashir Abood with De Novo, and you are listening to the Pharmacy Podcast.
Bashir, we are here at the SureCast 2025 Insights event. It's so good to see you.
Oh, happy to be here. Thanks, Todd.
Hey, you and I were talking at your booth, and you said something that really piqued my interest about cold chain and about storage and temperature control. Talk to our listeners about the opportunity they have to partner with you for a very specific sector of business.
Sure. So, I think we're all well aware in the pharmacy world about the influx and the growth of the GLP-1 market. We've seen pharmacies go from, filling, 300 prescriptions a week to doing over 30,000 a week in the span of just a couple months. So really having your cold chain solidified couldn't be more important.
And is it more than GLP-1? Are there other prescriptions that you see coming from the physicians that the pharmacies are caring for, where the De Novo technology plays in?
I mean, anything that would require 2 to 8 degrees Celsius
Okay.
for the most part. I think just in my role, with my experience in aesthetic sports and strength sports, with testosterone and GLP-1s, I could become a little bit of a subject matter expert at our company. So I'm able to walk into pharmacies and really talk the talk. I know the business from both sides of the counter.
So talk to me about the company's background and how you got into pharmacy in the first place.
Well, DeNovo was founded 14 years ago by my little brother.
No way.
Yeah. So we had an uncle several years ago who had a 503B compounding, essentially, cassettes for hospitals, fentanyl, hydromorphone, morphine. I was a tech at one point, as a matter of fact. He sold, I think, over 15, 16 years ago. And has poured really his investment has poured into his family. So we were able to start a company 14 years ago. And just this year in January, I've been selling commercial fitness equipment. Again, have known the industry for years. My brother said, "Come on down." I was in LA at the time. Said, "Come to Houston. I got a job for you," and here I am.
Holy cow! That is that's a special story. Be able to work with your brother. That's awesome.
It's incredible. It's incredible.
All right. So talk to us about the whole portfolio of what you're doing for pharmacy.
So essentially, I mean, if you have a clean room, a lab, wet lab, if you were even in the cannabis space if anything you could possibly need, with the exception of the active ingredients, we can provide. So if it's tacky mats, if it's vials, which of course are flying off the shelves right now, if it's cold chain, we've discussed that, if it's environmental monitoring, PPE, you name it. So we really like to consider ourselves a one-stop shop for everything. People can consolidate vendors. You have one person to deal with. Makes it a lot easier for our pharmacy partners.
All right, so I'm listening. I'm a pharmacy operator, owner. Is there a sweet spot that you work in? If it's independent, is it long-term care? Is it combo shops? Like, who are you gravitating towards?
Specialty, home infusion, and compounding primarily are really there are sort of three huge buckets or huge verticals in the pharmacy space, I would say. Long-term care, I don't see why we wouldn't be super helpful with that. Obviously, retail, we're a little limited on what we could provide outside of some pharmacy bags, but across the board, like I said, compounding, specialty, home infusion are really our strongholds.
Home infusion interests me because I think that is an opportunity for certain independent community pharmacies that want to get into that. Do you see that as a separate business unit, or do you see it mixed into a community pharmacy?
No, I think it could absolutely be mixed into community pharmacy. Absolutely. I mean, it's another revenue stream. Why wouldn't you? You're helping people in their homes instead of having to come to your retail spot. I think it's a brilliant idea to kind of just include it in your portfolio.
And you guys are supplying all of that supplies to actually get that going.
Everything from A to Z.
That's incredible.
Yeah, it's been fun.
All right, how does a listener reach out to you? What's the best place to get a hold of you?
Bashir at denovomed.com. Now, my name is very complicated, so think Bash, it's my nickname, and then an IR at denovomed.com.
DenovoMed. Spell that for the listeners.
DINOVOMED.
.com.
You got it.
Very good. Thank you so much, Bash, for being on the show.
Thank you for having me, man. Appreciate it. That was fun.
Hi, this is Jason Dana Costa from Horizon Pharmacy, and you are listening to the Pharmacy Podcast Network.
Hey, Jason, great to hear your voice here on the SureCast Insights 2025. How are you?
I'm doing really well. How about yourself?
I'm doing great. All right. So talk to me right out of the gate. Talk to us about your pharmacy. Describe to us the setting, what you focus on, and what your plans are for 2026.
Excellent. We're a pretty unique pharmacy. Our business model is a little different. We're a social enterprise that is owned by 3 community mental health centers in Rhode Island. And the majority of business that we do is with the community behavioral health centers. So we do a lot of substance use, a lot of behavioral health services. It's probably about 75 to 80% of our client base. But what's unique about us, because we are a social enterprise, when all our work is done, in addition to making sure the right medication has the right dose, the right time for those people using a packaged medication system, when all of our work is done, all the profits go back into the community. So our motto is, your community, our pharmacy.
That's great.
So it really helps. About 1,000 people a year get free or subsidized behavioral health or substance use care.
That's incredible. So I was in the substance abuse, opioid use disorder realm for about 4 years. We had 85 centers throughout the country, all medication-assisted treatment. And when I came in, it was my job to marry our services with outpatient situations or emergency room situations. Yep. And what we found is when we started getting a pharmacist involved with their therapy and started being a little bit more holistic and more 360-degree care, we were talking about diabetes or hypertension or something else that was part of the total treatment. The outcome was better. The attitudes were better. People felt that they weren't being judged because they were being talked with by a provider that was focused on everything instead of just honing in on, their addiction that they had.
Absolutely.
And I really learned a lot from that position, and that's why I wanted to talk with you. I want to know behavioral health and pharmacists. There's always been a firewall by my experience. Been in healthcare now for about 20 years, and there's not enough pharmacists in behavioral health specifically. And I think with psychotropics and the sensitivity of titration from one med to another, I think there's such a huge opportunity in it.
Absolutely. Fundamentally, we were birthed from 4 community mental health centers, now 3 because a couple of them has merged. So our work has always been very, very focused in connecting the pharmacists as part of the care team that is at each one of my owners. But we're trying to take that even further. So, for example, you're asking earlier about what's happening for 2025 and 2026. I was very pleased to join the organization about 3 years ago. And one thing we put in place this past year was twofold. We're training all of the techs that are in our team with mental health first aid training, both adult and children. So we require the adult. Children, they often volunteer to do. So they know the experience that's happening right at the front line for those clients and what's happening for the nurses and caregivers there. And then we're also encouraging all of our pharmacists, we have 7, to actually become board certified, specifically in behavioral health services. So we're going to underwrite both their training materials and the actual cost of the test so that they have that additional skill to help our facilities with that, which they don't have to, of course. They can take diabetes if they're interested or some other comorbidity. My goal is to give more education opportunity to our pharmacists so that they can lean in and really help those people. And interestingly enough, you mentioned MAT as a program. Recently, Rhode Island has become a CCBHC state. What that means is a certified community behavioral health center, which is a certain set of programs, 9 specific services that have to be provided. Among them is MAT. So now all of them have to provide at the outpatient MAT services, which is helping us integrate as a pharmacy with them because, of course, there's going to be a short script there, something that's just needed. Here's your initial 1 or 2 to help you with your alcohol treatment. Here's the rest of your script, and then here's to a program that can help you provide services around that. And then when I identified that CCBHC was rolling out in the state of here in Rhode Island, we made a very concerted effort to engage many of the substance use providers, those places that are typically going to get referenced from the CCBHC, that 21 or 28-day facility that'll help them detox. And what we found is oftentimes, no surprise for, I'm sure if you've done this work, that sometimes the first time going into the program doesn't work. It sometimes takes 2 or 3 to do that. But if we as the Horizon Pharmacy are engaged with all of these different substance use providers, we have their history. So they may join Xenia is one of them that's there, or the ASU 2 months later, or another one that we have, AdCare. Either way, we already have their record. So we're able to actually help the facilities coordinate these individuals to get them well. So it is super, super important to Horizon Pharmacy to be deeply integrated with all of the service providers in the behavioral health and substance use area in Rhode Island, because that's where we serve, because we know we have that back-end knowledge about the client really specifically that helps the caregivers at that point of contact where they're now engaging maybe the second and third time to become well. And I believe strongly that that actually helps the success rate for people to get to recovery.
That's a really good example of how pharmacists can be part of those care teams, and
Absolutely.
you seem to be leading with pharmacists in some ways, which I think is tremendous. I want to talk to you about SureCast specifically. How is your organization leveraging the data analytics extraction technology to get more out of not only your data, but being a little bit more efficient in your operations?
SureCast has been a tremendous godsend, I think, is a very fair statement at this particular point. Because we are a social enterprise and ultimately owned by nonprofits, to say that we're really thrifty, and not that all pharmacies aren't really thrifty. It's very tight margin. We've been hearing conversations about this at the conference all day today about managing your ingredient costs or your cost of goods sold. But there's an added thing in Horizon Pharmacy, because every time we give up one of those dollars, it's actually one person less who can get free or subsidized care. So it's made our culture much, much more sensitive about it. And then to come across something like SureCast that is able to bring in various secondaries and have the knowledge around your initial PVA so that you're able to manage it and then maximize your profitability, before your other operating costs, of course, has not been a small feat. I mean, we're just about a year using the product now. We started October 1st, but really started humming with it, I would say, in February. And just to give you a small example, our pharmacy shelves about 1,800 or so generics, which is where the PVAs make the most of their money, but also is most of our business. We've probably shrunk it by a solid 25 to 30%. That will free up a lot of dollars that now can be reutilized to make our pharmacy more efficient, because there's lots of new technology in various ways we're doing that, but also frees up the opportunity to make distributions to our 3 mental health service provider owners that literally impacts somebody who's going to get direct care that otherwise would not. So I couldn't do this without SureCast. It's definitely made our operation more efficient, and sincerely has made me more encouraged to expand our operation, because I know with things like the IRA forthcoming and all those various changes that are way above my pay grade in our little pharmacy in Rhode Island, I know part of the success is going to be, basically being able to grow the business. I'm in the tiniest state in the union. It's 35 to 40 miles across in either direction. So being able to not only show that we're an efficient operation on a very important thing to do, buying your inventory, that frees up the pharmacist team to work at their highest scope of service to help the facilities. And that is the ultimate selling point. I can open lots of doors for new businesses, but I'm not a pharmacist. I'm an accountant by training. I'm the CEO for the organization. It is ultimately the relationship with our pharmacy team, how those caregivers, doctors, nurses can get a fast answer to a question, can understand the drug utilization challenges, or to make a simple change with a best medication because something is stocked out. Not being busily figuring out how to make cash flow the next month. Because SureCast is making all things available. That releases a lot of mental load that allows our pharmacy to work at the highest scope of their services. And it's one of those things that you don't necessarily, it's not easy to draw a direct line to see that. It's not like one of those direct savings, but I can tell you as of 12 months of using this software, it is absolutely doing that. My pharmacists are able to engage in work that I would call truly pharmacist work, and not necessarily an accountant or an inventory manager's job. And oftentimes you need their expertise to make sure you're buying the right NDC for a variety of clinical reasons, but it takes the math challenge out of it, the finding the thing challenge out of it, the compliance, where are we sitting right now part of it. It automates a significant amount of things. It truly, like, it says cutting eye to say AI to lots of different things. But I feel confident that because of SureCast, there's no doubt about it, that Horizon Pharmacy is engaged actively in AI as a solution for our organization and those who we serve.
Jason, this has been wonderful to add you into the program. thank you so much for sitting down with me and sharing this. I want to invite you to This Week in Pharmacy, and so we can dig more into behavioral health specifically. So hope you'll come back.
I would happily do so. I will give you my card when we're done, and hopefully we can chat again.
Thank you, Jason.
Hello, it's Scott Whitnable with Independent Pharmacy Cooperative, IPC, and you're listening to the Pharmacy Podcast Network.
Hey, Scott, welcome. Hey, we're at the SureCast event here at SureCast Insights 2025. The first thing that I want to talk to you about is technology being used and leveraged in independent community pharmacy. It's a big part of IPC strategies. Talk to us a little bit about that.
Well, yeah, first of all, Todd, thanks for having me. And, technology is one of the reasons we're here. We're fully behind members using technology where they can. I know that inventory management is a big topic here.
Yep.
And going into the new year, it's really important to leverage the technology that you have in your pharmacy out there to ensure that you're ordering the amounts that you need, that you're tracking your inventory turns, and then what the cost of that inventory is. Because that's cash sitting on your shelves.
Yep.
And we've referenced that recently in our Buying Smarter series on our blogs, on our website. So, we believe greatly in that, and using technology can be very helpful, and many of our members are looking for those solutions. So it's great to be here, hear about how people are using it now, so that we can spread the word and get people in touch with the right products and folks to help them.
It's been busy time here in Nashville. It's been so good to see you and your team here. We have a lot of people at your booth. Talk to me about 2026. We're winding down. I think I've been to like 12 or 14 conferences this year. I see IPC everywhere. Last conference I saw you guys at was NCPA. But talk to me about what we're doing moving forward to be more profitable in the new year.
Great question. So there's a couple things that come to mind. Recently, within the last half an hour, I had a member ask, how do I know what to do to be ready for DSCSA? So that's the first thing. There's a lot of information out there, and I'd encourage you to go to our website, ipcrx.com, and we have some information, webinars, blogs, some resources that can get you down the right track. And then, of course, always reach out to us with questions. Secondly, though, with MTF, if that's the Medicare transaction facilitator. I get questions about that daily, Todd. It's really important to be prepared for that. So if you haven't signed up, again, go to our Co-op Connection page where we have blogs and webinars and different resources that can get you connected, and be prepared for that. So that I'll relate it back to inventory. The 10 drugs that are on the list, you want to be prepared to make sure that you can capture the rebates when they're available, and prepare now for the impacts to cash flow, as well as managing your inventory needs. There have already been several WAC decrease announcements that have hit the marketplace on some big brand name drugs out there. So if you haven't heard about these, reach out to your primary wholesaler, your buying group, or feel free to contact us at IPC, and we can help guide you through that. And secondly, after cash flow, the next thing to look at is understanding how those changes will impact your primary supply agreement, because those primary vendor supply agreements typically have quarterly changes that can activators that can reassign your cost of goods, especially from one quarter to the next. So, in a nutshell, understanding what the impacts of those are is going to be really important to help you manage your cash flow going into the new year.
So, Scott, what I really appreciate about IPC is the fact that it's member-owned. So if you're a pharmacy owner and you're in a specific state, maybe that state has different regulations or something that's changing things, you can come together as a whole organization, ask good questions, get other pharmacy owners, give you some advice as to what's happening. But I like the fact that you're giving me information with kind of red flags saying, hey, be on the lookout for this. When does those things go into effect for the new year, by the way?
Well, the deadline is approaching for MTF,
Okay.
so you really need to get signed up very soon so that you can begin to capture those rebates.
Okay.
And make sure you do it before the end of the first week of December so that it's done and you're ready to go for those MTF rebates. And then the others, there isn't a set deadline on when you have the whole first quarter to adjust to the impact on your cost of goods.
Okay.
And that's where programs like SureCast and IPC Warehouse can help you along the way. So don't be afraid to come to us and ask questions. And if we don't know the answer to have the insight into your primary agreement, maybe we can get you the questions that you need to be asking of the people that can get you that information.
Excellent. Scott, thank you so much for being part of the show. Thank you for your support of the Pharmacy Podcast Network, and we can't wait to work with you more in 2026.
It's great to be here. Thanks again.
Thank you.